The trend towards minimally invasive procedures in cosmetic medicine is increasingly expanding. Whether due to high-tech or hyperbole, most consumers of cosmetic surgery understandably would like something less to give them something more. But either through misinformation by word of mouth or less than candid social media posts, the consumer is often let down. That's not saying by any means that many minimally invasive procedures are not good, but oftentimes they're only as good as the practitioner. So choose wisely. In addition to her comprehensive cosmetic surgical practice, Dr. Lara Devgan is an expert in minimally invasive aesthetic enhancements. She's a plastic surgeon based in Manhattan. Her stellar education background is only eclipsed by her meteoric rise to one of the top plastic surgeons in New York City. On today's episode of Beauty and the BS, Dr. Lara Devgan talks about what works and what doesn't in cosmetic procedures, and how plastic surgeons may focus more on their Instagram and TikTok followers than on results. Dr. Devgan, thank you so much for joining us today.
Thank you, Peter. This is so fun. I'm so happy to be here.
I am very glad you're here. I have read and heard so much about you, and I'm so impressed with what you've been able to accomplish in a relatively short period of time. We were talking a little while ago, and I was looking at all of your educational background, and I go, oh my God, this girl is so brilliant. And I saw one common thread, and that's that we went to the same high school. So at least I can walk on you in your coattails a little bit that we went to the same high school. Of course, I was a few years before you. There we go. So thanks for coming to the podcast. Tell us a little bit about your practice and how you got started in New York City, and how your practice kind of evolved from your training to what you're doing right now.
I'm a board-certified plastic surgeon based in New York City. My practice is about half surgical and half non-surgical, and I focus on everything from the face to the breast to the body, really looking for bespoke and customized natural enhancements for my patients. And I like to tell patients that beauty is in the details, because I think that really eclipses and encapsulates what I believe to be the definition of modern beauty. I think that our old understandings of plastic surgery as this exaggerated, almost garish field with really big cheeks and oversized lips and exaggerated proportions, that is an image of yesterday that doesn't really mean what I think it's supposed to mean. And what I focus on in my practice is trying to give patients beautiful, subtle outcomes using the most modern technology available, the smallest incisions, the most tiny interventions that I can possibly achieve. I also have a medical grade skincare line, and I try to give people vertically integrated solutions, whether they're topical products, lasers, microneedling, injectables, suture suspensions, or full surgical procedures. And I'm passionate about trying to change the way we think about medical aesthetics and plastic surgery, because I think that for so long we've thought of this field as a superficial way to, fluff our peacock feathers, but I think that all of us want to feel like the best versions of ourselves, and that's kind of part of the human condition, whether it means working on your abs at the gym or coloring your gray hair or smoothing out a few wrinkles. And kind of what we really do is about confidence and putting our best selves forward.
I think that's very well said. I think that it really is about balance, about what we do. And I think there, for a long period of time, there was almost a sense of shame about those of us who would want to go and have a cosmetic procedure. And then there was almost a complete reversal of almost bragging about it on social media. I think that there's also a balance in what we do as surgeons or practitioners of cosmetic medicine. There was a time when this overly done, accentuated look was something that people would I don't know if they'd strive for, but that's what they would get. And now we've seen a shifting towards a little bit more moderation. How do you explain to your patients what they can get with minimally invasive procedures, which is a part of your practice, versus what they can get with a more standard, perhaps more invasive surgical procedure? Because I have to imagine that you see a lot of people who come to you and say, "Hey, I want this minimally invasive procedure," and you've got to say, "Yeah, that's not for you." How do you educate your patients on that?
I think one of the best ways that I educate patients is showing people a lot of what I do. So I have thousands and thousands, almost 10,000 examples of before and after photos and process videos and procedural videos of my work on my practice Instagram page. And I think by just showing people literal examples of what I do, that helps to demystify a lot of not just the before and after, but the during and the process and the recovery and the who, what, why, where, when, how, and the motivation. And so I think on one hand, we're in this era of information overload, but on the other hand, there is so much we can do to fill in the gaps of what happens with a certain kind of procedure. So that's number one. Number two, when someone really is not that familiar with a procedure and it is time for me to explain it a little bit better, the way I explain the difference between non-surgical and surgical procedures is very much anatomy directed. So if somebody has a bigger anatomic concern and a bigger problem, it's going to require a bigger solution. And not every nail requires the same kind of hammer. And just because your friend had a really nice result with the little injectable procedure does not mean that you're going to have that exact same result unless that's your identical twin. And I think that is part of the art of the plastic surgery consultation. And then that is the reason why everybody really needs not just the fluid that's getting pushed out of the syringe, but they need the art and the science and the analysis of what's going to happen next. So there is a huge gap between theory and practice. I think expectation management is one of the most important things that we can do for patients. Because if you want the feeling of a full mid facelift, lower facelift, and neck lift, but you have in your mind that you're going to do a little filler in your cheekbone and jawline, you're going to be sorely disappointed from a budget standpoint, from a results standpoint, and from a procedural standpoint. And you really need someone who has the wherewithal to disabuse you of that misconception right at the jump.
I think that oftentimes people look at the face, at least, and actually the rest of the body as a static, one-dimensional object, and that's where their focus is. And for the face, it's not just descent, but there's deflation and deterioration, and treating those different entities are different. So someone who tries to treat deflation by pulling back too much is going to have that windswept look, or someone who tries to overtreat descent with inflation and with fillers is going to have that pillow face, that look where you've changed the shape of the face where you can see it from across the room. So being able to get balance to your patients in their mind, I think, is important. But the way they get to see you is going to really now has changed over the last, decade as social media has come into play. You have a huge following on social media, but I notice that your social media is different than a lot. It goes to more about what you had just said earlier, a lot of before and afters, and not so much entertainment as a performer on social media. Tell me your feelings about social media, and I want to lead into that, because that then is ultimately going to lead us into the procedures that you're going to do. But no one's going to know what procedures you do unless there's some way of advertising them. So how do you use social media to educate the public and ultimately your patients?
I mean, social media is just media, right? At this point, social media is the way most people consume information. I think when I was coming of age, it was a big deal because, getting my first cell phone was a rite of passage. But now the way I think about things is so different because a cell phone is a little computer. And if a cell phone is a little computer, then Instagram is a little website. And social media is a way of putting information into the world, and it is a magnifying glass that amplifies who you are and what your message is and what your personality is. And if you are a comedian, you can be very funny on social media, or you can bomb. And if you are a plastic surgeon, I guess you can be that doctor who dances in the operating room. I'm not that person. I have never been that person. I'm a very serious academic person. And that's how I feel most comfortable using social media, just as a way of amplifying my personality. Peter, as you know, plastic surgery is a super academic field. And for those of you guys listening to this, you may not know this from the salacious media representations of flashy cars and fancy rodeo drive scenes on E! Network, but plastic surgeons are some of the nerdiest people you will ever meet. It is an ultra competitive medical subspecialty where you have to have top board scores and top grades. You have to know your facial and body anatomy cold. You're kind of a bookworm if you're a board certified plastic and reconstructive surgeon. And that's honestly one of my favorite things about the field. It really marries art and anatomy. And to me, the best way to use plastic and reconstructive surgery on social media is to convey those messages to the public so they can understand not only the deeper meaning of beauty, like how to dignify these feelings we all have as we see our bodies change when we have a baby and it doesn't exactly look and feel the way it used to, or when we get a little older or our hair changes color, or we maybe feel a little self-conscious, or these more complex topics when people feel like their outside doesn't match their inside. So I like to dignify human stories, but I also like to convey a little bit of what I am seeing with all of this extensive training and, this body of decades of knowledge that people like us have racked up through years and years of training and expertise. So there's this expression I like that the eyes only see what the mind can comprehend. And so I think social media is a very amazing way to teach people what you're doing so that they can understand it better. And so that's how I most like to use it. And some people find it a little boring, but that's who I am. I'm a little bit boring. And that's what I like to do. And so people who like me like that kind of stuff. If you want to see a doctor dancing, I'm not really that good of a dancer, so I'm probably not your girl. But I also, in all seriousness, really hate that kind of stuff. I think it trivializes medicine and it doesn't dignify the patient experience. And I think it makes our profession feel distracted, and I just don't like it. That's not what we signed up for.
Yeah, I kind of think that your philosophy these days is almost that of an outlier. I absolutely love what you just said. But when I see some of our colleagues, and some of our colleagues who, by the way, I think are outstanding surgeons, but there's this almost famous feeling about what they want to be like. And when I say famous, it's an anagram for fear about missing out syndrome. That we have a physician TikTok narcissistic disorder where we have to show ourselves in ways that we wouldn't normally do to promote our practice, but more to promote ourselves. Now, part of that I understand. I mean, so many of us, myself included, we have hired social media consultants to try to generate business. What we do is a business. But we would hope that we would have more credibility, some more cachet, if what we're putting out is more exemplary of what we do rather than who we want to be perceived as on social media as an entertainer, just to grab eyes. There's kind of a cringe factor out there sometimes when I see our colleagues, doing a dance in the OR, and I'm just saying, I can't believe you're doing that because you're so good and your results are so good. Why do you feel the need to do that? On the other hand, sometimes I see people who just spend their entire time on social media doing things that are totally not relevant to what they produce, and yet that drives business. And there may be people who do excellent work who don't have the same type of persona and are missing out. That's just my little rant on social media right now. I think there's so many incredible things about it, and I don't want to misstate that. I think that social media is a huge thing that we all benefit from. But like everything, like plastic surgery, there's a balance. And I think you handle that balance well. You've been able to generate a lot of interest in your social media, but that it's focused on what you do and the results that you get. So hopefully your social media accounts will be more exemplary to those who follow you.
What's interesting on that note is that in looking at the analytics of my social media, the posts that do the best are the ones that are not about my clinical work. So people still want lifestyle content, and it's very interesting. And so I've made a deliberate decision. I realize that I'm, a young-ish woman, as well as a plastic surgeon, and I wear many hats and play many roles. But as a woman in a field that's still very much a male-dominated field, and as a woman and a surgeon, I have friends who are similar to me, who are young women surgeons who have made different decisions, who post a lot of photos that are fashion, lifestyle photos, and who get a lot of attention for having great clothes or a cool lifestyle or going to great parties. And it feels more like a fashion blogger kind of social media account. And it's very cool. I don't begrudge them that, and they're fun to follow. It's a fun follow. And I have noticed the same thing for myself, that those posts do much better and people are much more interested in those posts. And I have made a non-business decision, like a not good business decision, to not post that content because it just bothers me. And it is already way too easy for the negative forces out there to dismiss women of substance for being too girly and too frivolous and too fashiony and getting by on their looks alone. And all of the things that I've been hearing really honestly since I was 5 years old. It is way too easy for people like me to get dismissed for all the wrong reasons for doing stuff like that. So I have had to make a deliberate decision to not post high-performing content in order to be taken seriously in my field. So I just wanted to point that out as food for thought for the next generation of whoever is listening to this. And the next time someone listening to this hearts one of my posts, where occasionally, like maybe 1 in 50 posts, I'll throw everyone a bone and like make myself happy and post a photo from like going somewhere fun. But 49 out of 50, it's all clinical photos. And that one does so well. And I just always wonder why. And just throwing that out there. But I do think that the field as a whole benefits from having more information and less frivolity. And so that's also the same reason why, even though I do like to go to fun places and I do have friends and I do have nice kids and a nice husband and sometimes I do dance, I don't try to post that stuff because I want to focus in on professionally what I think really matters.
Yeah, I don't think we need to avoid having fun or showing that we're human beings. But I do think that there comes a point where we cross that line, and we go from good to bad to kind of cringy. And I think we got sometimes need to take a step back and look at what we do and wonder, why did we go into this field? Or we're trying to be entertainers? Or are we trying to show people
Totally
about?
agree with you. Totally agree with you. Yeah, and avoid the cringe factor and avoid the greased up, lubed up bodies in the operating room.
Yeah. Yeah, I do. I often wonder when I see some of these posts where, before it's a very dry field, and at the end the aha reveal, and it's like a bodybuilder who's out in competition where everything is greased up and lubed up and the lighting is changed at the end of the procedure, and I'm going, am I the only person who's recognizing that we're looking at two completely different perspectives on this patient?
I know. I was asking someone the other day, so where do you get the grease? Is that sterile? And am I supposed to have sterile mineral oil in the OR just for the after photo?
Yeah,
I don't stock that routinely.
Yeah, it's interesting. And a friend of mine, again, an excellent surgeon, he was on this podcast, and I see that on his before and afters all the time. And I go, you don't need that. It's distracting to a certain extent. But I assume that it just draw attention and draw followers. And yeah, I think that's really the focus of this podcast, is to understand that, look, this is a business too. And so just, be aware. As I want to shift back a little bit now from social media to the fact that what social media does is it tends to draw patients who are looking for something specific. As you mentioned earlier, a great percentage of what you do is comprehensive surgical aesthetic surgery, from the belly to the breast, face. But because for many reasons, people want to have lesser procedures, you've learned to be able to deliver using your knowledge from an academic standpoint, from an anatomic standpoint, on some of these minimally invasive procedures. So I want to kind of go over some of these, what works, who it's indicated for, and maybe educate our audience a little bit on really what it does and what it doesn't do. So one of the things that you see, and it is not limited, and in fact, it's oftentimes offered by other than plastic surgeons, and that's a non-surgical rhinoplasty. Can you explain a little bit about what a non-surgical rhinoplasty is and how you utilize it in your practice when you have the tools to do a surgical rhinoplasty, and what it is that you're hoping to achieve with that procedure?
Yes. So a non-surgical rhinoplasty is a minimally invasive procedure wherein I use injectable hyaluronic acid-based filler to improve the contour and shape of the nose by treating filler as if it's a surgical cartilage graft. And this technique is best for patients who have irregularities in the shape of the nose, particularly those who have a dorsal hump or bump on the nose, a downward pointing nasal tip. It can even be helpful for those who have a bulbous tip, for those who have irregularities after a prior surgical rhinoplasty, including an inverted V deformity, notching of the alar rims or nostrils, or asymmetry from the left to the right. It's less powerful for patients who have a broad or wide nose, or who have increased width of the nostrils, who may benefit from a subtraction procedure. And one way to kind of think about this this procedure is you may be better suited for a surgery if you have breathing problems, or if you're hoping to narrow the width of the nose. You can have a nice result from a non-surgical rhinoplasty in pretty much almost any other case.
And how long does it last?
It really can depend on the patient, but it can be somewhere between 6 months and 18 months. I generally tell patients that neuromodulators like BOTOX need to be maintained around 3 months. And for fillers, check in around 6 months, but that could be just a visual check in. 6 to 12 months. If it looks good, I go by the mirror rather than the calendar. And I think that's a key point to avoid that feeling of filler dysmorphia and the puffy, overfilled filler face.
So you have an extensive background in surgery and anatomy, so you kind of understand where you will place this filler and where you shouldn't place this filler. Share with our audience what the potential complications can be for someone who may not be as knowledgeable in the anatomy and is performing these type of procedures.
Yeah. So, I think filler in general, injectables in general, have really become the wild west of medicine. I think it is truly a terrifying world to age in now, given this. But risks of injectables are severe. They're extensive. You can risk things as serious as tissue necrosis, which is death of the tissue on the face, and including the central triangle of the face. You can risk permanent and irreversible blindness from any filler injection anywhere on the face, even in a remote location like the lip or the cheek, but particularly in the central triangle of the face, like the temples, the glabella, the periorbital area, the nose, the nasolabial folds. And there have even been cases of filler that has embolized into the cavernous sinus. I read a case report of a cavernous sinus embolus that caused a stroke and caused a death. So can you even imagine a filler injection causing you to die? And that was not in this country. It was a case report from an Asian medical journal. And obviously that's not something that is routinely reported, thank God. But it is a brave new world. And I think that there are fewer and fewer gating issues and regulations that are backstopping people from entering this world of injectables. Even the language that we use to talk about non-surgical procedures has changed, right? Forget about being a board-certified plastic surgeon, right? Now everybody is a provider or an injector. What does that even mean? Forget about the 4 years of medical school and 6 to 10 years of residency and fellowship. It's like you're an injector and you got trained by like the pop-up shop training course, which was a 3-hour program where someone made a PowerPoint, and who knows who made the PowerPoint. It was given to you by an injectables company. And those multi-billion-dollar companies have the incentive of selling as much product as possible. And so all they do is get one on-label indication, and then they sell it by the syringe. So I just think that, I can't emphasize enough this idea that the face is extremely complex. The anatomy of the face is super duper complex. There's a reason why everyone looks so weird in every restaurant in America. And that is that aesthetic judgment is being lost. And we need to roll it back a little bit. We need a little bit more restraint in this field, and we need a little bit more of these old school traditional values. And I say this as a modern person, but we need a little bit more of the old school traditional values and the training pathway. The whole goal of the punishing concept of a surgical residency is to make sure that you're an expert in the three-dimensional anatomy that helps reduce the risk of having a catastrophic complication. And to the extent that it's possible to mitigate that risk, would you not want to do that?
I think that's very well said. I think that, it's not something that should be taken trivially. Over the last generation, we as plastic surgeons have grown to recognize the anatomical benefit from a rejuvenation standpoint of adding volume, because we lose volume as we get older. But I do think that of the things that look the most unnatural is when the practice of adding volume gets out of control and is overdone, and that's where you see it from across the room. And it's interesting that doesn't have as much a negative connotation in the public eye or in the public perception sometimes as neuromodulators. Now, for the audience, we've, as plastic surgeons, don't want to say a brand name all the time. So, but when we talk about neuromodulators, we're talking about things like BOTOX or Dysport or Xeomin. And we've changed from saying neurotoxins because we figured that's not a good sell. So we say neuromodulators now. But basically, things like BOTOX or Dysport or Xeomin or other neuromodulators, personally, I think, have a really bad rap because I think they're one of the things that really do allow for enhancement, have a relative, not a zero, but a relatively low risk. The one good thing about BOTOX is that it goes away. And the bad thing about BOTOX is that it goes away. But it's something that I think is maligned probably more than necessary. How do you use neuromodulators in your practice, and are they on the top of your list, the bottom of your list, somewhere in between as to what you like to provide for your patients?
I think they're very helpful. I mean, I think that neuromodulators are definitely part of a nice regimen that helps reduce signs of facial aging. I think BOTOX in general, and I say that term generally as you do, but just for understandability, I think BOTOX in general is very misunderstood. I think we as plastic surgeons can use it better. I think the prettiest ways to use BOTOX for the face are to think about it as a way to improve skin quality and to shape the eyebrows and symmetrize the upper third of the face. And I also really love BOTOX neuromodulators for slimming and tightening the neck. So I think platysmal band BOTOX is super helpful. I predict that in the next decade that plastic surgeons are going to lean into the idea of a little bit of a lower dose of BOTOX in the upper third of the face and a higher dose protocol for the neck, because I think that anecdotally in my practice, I've noticed that I'm able to very much control platysmal bands with high dose platysmal BOTOX, like 150 to 200 units for the neck bands. And then I'm decreasing dosing for the face, like 30 to 40 units for the entire upper third of the face for typical patients in the age range of 30 to 50. And I think that keeping a little bit of movement is important. You know, I still see a lot of patients who will raise their eyebrows and say like, oh, I still have a little wrinkle here. The BOTOX isn't working. I need some more. And I think that mentality is not a great way to think about neuromodulators because it's normal to have facial movement. And so I do worry a little bit about the generation, probably our parents' generation, actually, one generation older than me, who wants to have zero movement in the face. I think that's a problematic way to think about BOTOX, but I do think it's a super helpful tool in the toolbox.
Let me run some other minimally invasive treatments by you, and then I want to find specifically if there's ones that I've left out that you think are real helpful for your patient population. And obviously, that also depends on the age of your patient population, because something for someone in their 30s and 40s is not necessarily something you're going to use for somebody in their 50s or 60s or late 70s. Tell me, what do you think about thread lifting?
So I think that, old school threads or old school thread lifting, I think I always have hated and still do. I think the older generation of threads were very weak and had to be placed superficially in a subcutaneous plane, and that lent themselves to a lot of complications. So you could have extrusion through the skin, you could have pleating and rippling, you could see them break, and then you could have unevenness on both sides. So really a lot of complications, not very durable, not great aesthetic outcomes. I think the newer generation of PDO or polydioxanone threads or suture suspensions, where the sutures are custom molded. So I hope I'm not getting too technical, but rather than having a suture that is a solid material that's then etched out in order to create rasps or barbs in it, a newer generation of suture is created with a custom mold. So a liquid form of polydioxanone is poured into a custom mold, and that allows it to have a little more structural integrity. So each one of these is able to support 2.5 pounds of pressure, and that allows me to place them in a deeper tissue plane. And I'm able to achieve really nice, beautiful outcomes with those, and I've been very happy with those results that last about a year. I'm doing those suture suspensions in the mid face, the lower face for joweling, in the neck and in the brow area. And I've had some very beautiful results. Patients are super happy with those. I think of suture suspensions as an adjunct for patients who want more lift than I'm capable of achieving with fillers, but who are not quite ready for surgery. And I think that that is important, because at a certain point, you don't want to just keep making a person's face bigger and bigger and bigger. You want to do something that will give them lift without increasing the size or volume of the face.
What about radiofrequency microneedling or microneedling in general? Do you believe in that, and do you utilize it in your practice?
I think that I like the concept of microinfusion microneedling. So shallow depth microneedling. So I like to use microinfusion microneedling with a custom cocktail of BOTOX, hyaluronic, and platelet-rich plasma, micro-injected in a sterile single-use device about 500 to 600 microns deep, and you get this sort of beautiful poreless glass skin look. Sometimes patients think about this as a glass skin facial, and you can use the power of BOTOX to get porelessness. You get some infusion of hyaluronic acid. The microneedling gives you some collagen induction. I've leaned significantly away from very deep microneedling at the 1 to 2 millimeter depth. I think that can tear up the skin and doesn't give the type of collagen induction that I had always hoped that it would give. I really did not see an improvement in skin quality for my patients. Radio frequency has been around forever. I don't hate it. I think that it is a little, I don't know, I guess I would say underwhelming. I think it's the least offensive of the thermal skin tightening concepts, because it is the one that is least likely to denature the proteins of the face in a permanent and awful way. But that also means that in order to, really see something from it or get the proposed collagen induction, you're doing it quite a lot. So it becomes onerous for patients. And I don't think that the bang for the buck is always adding up for people in the way they want it to. So I guess to put it another way, when people go in wanting radio frequency, I think they're hoping to leave with something more than what they get from it. So I think that there are companies like, there was a period of 3 months where I think maybe 50 people asked me about Morpheus 8. And, my question for them is, who is the PR company for Morpheus 8? That is my question, because if I could think of 2 methodologies that have been around for more than 50 years that have no reason to have a resurgence at the same time, it would be microneedling and radio frequency. And, please don't sue me if you're listening, Morpheus 8. Like, all love here, and these are my opinions only. But that was the most interesting part of the Morpheus 8 rise to social media prominence, was who is your PR? I need to know. Tag me. DM me. I'm gonna call them because I think that those are both totally acceptable modalities, but nothing new here.
Yeah, InMode is a company that does Morpheus 8, which is the radio frequency microneedling. I'm kind of maybe a little bit more positive than you, but I do feel patients are often underwhelmed if they think it's a one and done. There's none of these treatments that I think are a one and done, and certainly the microneedling is not. But I do think that you will see some changes over time. But I think that's what's the beauty of something like this, is to be able to get differing opinions based on our own personal practices. Because I actually some of the things that you get more benefit out of, I haven't gotten as much benefit out of. But oftentimes it's also technique. You learn from your colleagues. Oh, maybe Lara's doing something, better than I'm doing, and I've got to kind of follow her and see what she's doing. But I like the fact that we're able to talk about things that work and things that don't work. But speaking of things that don't work, in my opinion, and maybe they do in yours, how do you feel about either cold-related or heat-related fat reduction?
Not good. Thumbs down for me. I think that I don't feel good about those things. I just think that I love the idea of cryolipolysis, and I think that it is very cool. No pun intended.
No pun intended.
And it's a hot topic, also no pun intended. But we're just not there yet. I think that we've not totally figured out how to make those very interesting concepts and very cool modalities into predictable, safe, reproducible, low complication rate procedures for patients where there's going to be a really high satisfaction. And I think those are the things that we need. Sometimes as a litmus test, I think to myself, would I do this on my own body? Or, my mom or my sister? And if the answer is no, then I don't want to do it for my patients. And the answer for all of those things is no.
Yeah, I've not been impressed with the cryolipolysis, and that's basically, for those of you who are not familiar with the term, putting an external device on your skin and what they call freezing the fat. I just have been underwhelmed, and conversely, I actually for a while was promoting the heat-related external device that you would put on. And I was trying to convince myself that it worked. And I was convincing myself because I bought it. Okay. And once I bought it, I needed to sell that procedure. And the more and more I would use it, the more and more disappointed I was with myself that I was promoting this. And I think we tend to get sucked into promoting devices that we invest in. And that's, it's a tough thing for us as surgeons to admit to, but if we're honest with ourselves, oftentimes we do get sucked into the, not wanting to miss out on a technology that our neighbor has. And ultimately we realize it probably doesn't work quite as well as the vendors were pushing on us.
Yeah, I have been offered some expensive devices for free for my practice. And I have declined them not because they're not valuable. They're expensive, 6-figure devices for my practice. And the reason that I've declined accepting them is because at a certain point, at every point, honestly, you need to think about what is the right thing for your patients. And, I had to think to myself, how am I going to answer to my patients? I don't want to do these procedures, whatever short run amount of time between doing the procedure and then having the patient come in for a follow-up visit with an expectation of an outcome. That amount of net happiness is not going to outweigh the net unhappiness between the follow-up visit and then the whole rest of my life. And so I declined, and that's happened to me a couple of times, which is interesting. I never thought I would be in a position to say no to an expensive gift. But sometimes a gift, as they say, there's no free lunch.
Is there...
Probably wasn't going to be a free lunch. I never lived to tell the tale about what happened when the other shoe dropped, but so I don't know what would have happened. But
Is there something you're excited about now as far as either technologically or procedurally that you say, hey, this is something that I think has legs to it and my patients are really going to like?
Great question. I have been excited about, like, kind of the thing that has been keeping me excited the past few years has been working on getting my incisions for my surgical procedures to be smaller and smaller. So now I've gotten my breast augmentation incision to be under 2 centimeters. So that was a threshold that I was trying to get to. And so now that's my routine breast aug incision size.
With the saline or silicone?
With silicone, and which is smaller than the mouth of a Keller funnel. So it's like with some challenges. So that is that's really great. So just to put that in perspective, when I started my residency, I would see these enormous breast augmentation incisions, and the cases were super long and somewhat bloody. And now it's very elegant to do an incision less than an inch and in the inframammary fold, and the patients are very happy. So that's been really great for me. I've been working on closing my lip lift incisions with the same technique I used for my upper lid blepharoplasty. And so those scars are looking really beautiful. So I do a running intracuticular closure there, like a zip stitch closure. And that's something that I've been doing for the past like 6 or 8 months. And in the past, I had done a more traditional baseball stitch. And it's just been a really, I used to tell patients it's going to be a couple of months before those lip lift scar looks good. And now I have been able to get this scar to look good at like a week or a week and a half, which has been wild because that used to be the only thing I hated about a lip lift was the scar. Babysitting someone through the scar. And now it's like a bleph scar, which is a beautiful scar. As you know, it's just like the best operation in the world. The upper lid bleph, like I sometimes think about when I retire. I never want to retire because I like really love what I do. But one time somebody asked me, when you retire, what's the one operation you're going to do over and over and over again if you only could do one when you retire? And I said, upper lid blepharoplasty. I'm only going to... What would you do if you could only do one when you're...
So I think upper lid definitely would not be lower lid blepharoplasty. That's a little bit more challenging. But I think upper lid blepharoplasty is an excellent procedure because you make the patient look just so much more refreshed. The scar is well concealed in the fold of the crease of the upper eyelid, and you're right. In a very short period of time, you don't see it because some of these other procedures that we do, the bigger procedures. Great procedures, but it takes a long time for the scar to settle down. You can do a tummy tuck on somebody and wow, it's a great body contouring procedure, but you've got to coach them a little while for those scars to go down. And even in breast augmentation, so I'm very interested in what you're saying because in a inframammary incision, the incision underneath the fold of the breast, in a lot of people, the scarring can be hyperpigmented or darker or thicker for a longer period of time, and you just got to coach them through that. There's lots of things you can do to fade the scar, but people really like it with an immediate result. So I'm going to have to call you up on this this small incision for silicone implants because that's not easy to do. One of the things that I tell my patients is that your body's going to keep aging no matter what. So they are always asking, well, how much younger will I look? Well, you'll look younger, but the clock doesn't stop. You've got to do something in between. There's got to be some maintenance. Part of the maintenance is to have a skin care routine. You have developed your own skincare line. Tell me a little bit about that and how you implement that in your practice.
Yeah, so that was the other thing that I was actually going to talk about in terms of future directions. But so the whole idea behind my skincare line is bringing a little bit of the magic of what we do in our daily lives in the operating room, in the procedure room, to a person's bathroom mirror and their vanity at home. And there is, as you know, a huge body of medical and scientific research that supports the use of certain molecular substances like retinol, vitamin C, vitamin B, vitamin E, ferulic acid, acetyloctopeptide, hyaluronic acid, niacinamide, bakuchiol, all of these substances, and tons of evidence basis for these on PubMed and elsewhere. And bringing these solutions to people in, beautiful, usable, user-friendly formulations that have a nice product feel, acceptable scents. There are other little quirky things like the tackiness of the product, the user experience, some of these little things that make it fun to wear a product, and that increase loyalty. And these things not only improve skin quality, but they help with the concept of skin aging over time. So if you're able to reduce oxidative damage to the skin and reduce the accumulation of fine lines over time, then that also means that you're reducing the number of BOTOX units that you're going to need at your next visit. You're decreasing the frequency of erbium laser resurfacings and microneedling treatments that you're going to need. You're slowing the rate of platysmal band Botox, or the age at which you might need your first neck lift. And you're kind of pushing back this concept of aging or putting it on a different time pathway. And one thing that I've gotten into, besides just my skincare line, is kind of this larger topic of biohacking. And I know that that's been adopted in the colloquial world to mean a lot of different things. So I'm not sure I mean all of them for myself personally. I'm not doing the thing where you stay up all night for 7 days, because I read about that somewhere. So I'm not doing that one, although it would be very useful for me. But I do like a few of these ideas. So besides super meticulous, judicious medical grade skincare, which I'm really, really into, I also like to try to minimize sun exposure. I've been very focused on beauty from the inside out. So I have a range of gummy nutraceuticals, which are vitamins, supplements. One of our most popular ones is 32 green vegetables, prebiotics, probiotics, vitamins, and minerals in the form of 2 green vitamins, which I actually developed with my children in mind, but also my own diet is sometimes leaving less, it's leaving something to be desired, with a lot of simple carbs and Diet Coke. So, just thinking about how what we put into our bodies is impacting the way we look and age. And then I've been focusing a lot on trying to get more sleep. I think there's a ton of data that suggests that insufficient sleep impacts how quickly we age and telomere length. And I think for busy people like me and you, and probably a lot of people listening to this, there's almost this cult of sleeplessness. You're really cool if you only sleep for 4 hours a night or whatever. But I think that that's not actually accurate. So I think getting more sleep is important. And then I've started intermittent fasting as well. There's a ton of mice data that shows that that's helpful.
Yeah, I've been doing the intermittent fasting as well, and I think there is some good data for that. Getting the sleep is hard, and I can't imagine how you get sleep. You're an entrepreneur, a businesswoman, an amazing plastic surgeon, a mother of 6 children. Is that correct?
Kids, yeah.
How you fit sleep in, I don't know. And how you were able to come up with a time to give me on this podcast, I don't know. But I am so immensely appreciative. Dr. Lara Devgan, tell everybody how they can find out about you and your practice, and if they want to find out where you're at.
You can find me on Instagram and TikTok you can find me on Instagram and TikTok at Lara Devgan, MD, and my skincare line in both places at Dr. Lara Devgan. And I'm based in New York City, so come and visit me anytime.
Lara, thanks so much for being with us today, and it was really a pleasure to have you on the show.
Thank you. This was so fun.
Oh, we'll have to say goodbye on TikTok. That's it for this episode of Beauty and the BS. Thank you all for joining us, and please join us again for our next episode. And if you like us, maybe leave us a comment. Enjoy the rest of your day, your evening, whenever you're listening to us, and we'll catch you next time. The Beauty and the BS podcast executive producer is me, Dr. Peter Grossman. Our producers are Max Banta and John Largent, and editing and post-production services are provided by Game Day Media. You can listen to Beauty and the BS wherever you listen to your favorite podcast. And if you would like to leave a comment or ask me a question, go to beautyandthebspodcast.com and click on the microphone icon, and we may use your comment on a future episode. You can also find our archives, video clips, and more on the website as well. Thanks for listening to Beauty and the BS with Dr. Peter Grossman.